Are you diagnosed with insulin resistance or type 2 diabetes? Some people may not realize they have diabetes until they notice specific skin symptoms. Timely treatment for skin infections is vital to prevent worsening and challenges in managing the condition. Today, I'll cover 12 skin indicators of inadequate diabetes control or insulin resistance. If you have been diagnosed with insulin resistance or type 2 diabetes, it's essential to be aware of these 12 signs. In this video, we will explore the effects of diabetes or insulin resistance on the skin. Diabetes can impact various organs in the body, and the skin is no exception. People with diabetes may notice skin irritations that can be attributed to uncontrolled high blood sugar levels or, in some cases, may not even be aware of their diabetes until they observe these skin manifestations. Therefore, it is crucial to watch the complete video to access all the helpful advice and techniques that I will be sharing. Remember, it is important to regularly consult your diabetes doctor and dermatologist if you observe any of the following signs. Number 1. Yellow, reddish, or brown skin patches known as lipoic necrobiosis are small, raised, and firm bumps resembling pimples. These symptoms are commonly associated with the disorder. Over time, these pimples develop into swollen, hardened patches of skin. Additionally, yellow, reddish, or brown spots may appear. Primarily found on the legs, it features red, puffy, and hardened areas, along with a glossy appearance and visible blood vessels. Managing diabetes is crucial if diagnosed or uncontrolled, as this condition can cause issues and affect aesthetics. Number 2. If you notice a smooth and velvety sensation accompanied by darkened patches of skin, it could be an indication of elevated insulin levels in your body. These patches, appearing as black or brown, may be found on various parts of your body such as the back of your neck, under your armpits, in the groin area, or elsewhere. This condition is quite common among individuals with prediabetes, medically known as acanthosis nigricans. It is a skin disorder that results in the darkening of the skin, particularly in the folds and creases, and it can serve as an early warning sign of diabetes or insulin resistance. Number 3. Digital sclerosis is the hardening and thickening of the skin, primarily affecting the fingers but possibly impacting the toes as well. It results in tight, waxy skin on the back of the hands and stiffness in the fingers, hindering movement. In cases of poorly managed diabetes, the sensation can be likened to having pebbles in the fingertips, with rigid, swollen skin extending to the forearms and upper arms. Occasionally, it can also manifest on the upper back, shoulders, and neck. Unfortunately, this condition can spread to the face, shoulders, chest, and even the knees, ankles, and elbows, causing discomfort and difficulty in leg and arm movement. The thickened skin often resembles an orange peel texture and is more likely to occur in individuals with poorly managed diabetes and its complications. It's vital to notify your diabetes doctor of skin thickness symptoms, as improving diabetes management enhances well-being. Alpha-lipoic acid and benfotiamine supplements may offer relief, and physical therapy could be required for joint flexibility when thickened skin impacts fingers, toes, or other joints. Number 4. Blisters in individuals with diabetes can appear unusually, either as large singular blisters or clusters, commonly found on hands, feet, legs, or forearms. Their resemblance to severe burn blisters is striking, but unlike burn blisters, they are typically painless balloon-like protrusions on the skin. These blisters are medically known as bullosis diabeticorum, a term that adds sophistication, or colloquially as diabetic blisters. Reporting them to your doctor is crucial to prevent infection. Seek advice from your primary care doctor, podiatrist, dermatologist, or diabetes coach for effective diabetes management and proper blister care. Number 5. If you frequently suffer from yeast infections, impactions, or are prone to infections, it is possible that you have diabetes or uncontrolled diabetes. Skin infections exhibit several noticeable signs. Firstly, your skin will feel hot, swollen, and uncomfortable. Additionally, you may observe an itchy rash accompanied by small blisters. Dry and scaly skin is another common symptom, and the presence of discharges is not uncommon. These discharges can vary, ranging from pus to cottage cheese-like appearance. Skin infections can occur anywhere on your body, but they are more commonly found between the toes, around nails, or even on the scalp. Maintaining dryness in your toes and toenails is crucial to prevent fungal infections. Number 6. Open wounds and sores, more serious than mere infections, can occur without infection due to post-circulation or nerve damage from uncontrolled diabetes. These conditions can lead to deep, hindering ulcers that compromise natural healing. Circulation and nerve damage worsen the problem, transforming small lesions into vulnerable ulcers prone to infection. Daily self-examinations are crucial for people with diabetes, as periodic checkups alone are insufficient. Taking charge of foot health through proactive daily inspections is highly effective. Immediate medical attention is vital if an open sore or wound is present to prevent severe infections and potential amputations. Close communication with a doctor is essential for addressing any skin abnormalities. Number 7. Shin spots, a skin condition associated with diabetes, causes subtle depressions, spots, and occasional fine lines on the skin. While not exclusive to diabetics, they are more likely to develop this condition. Commonly known as diabetic dermopathy, shin spots primarily appear on the shins but can also occur on the arms, thighs, trunk, or other body parts. These brown spots, often mistaken for age spots, show no symptoms and gradually fade away within 18 to 24 months. However, if diabetes is poorly managed, diabetic dermopathy may persist indefinitely. Number 8. Small, reddish-yellow nodules, also known as eruptive xanthomatosis, manifest as lumps that bear resemblance to pimples upon emerging. However, unlike pimples, these lumps rapidly assume a yellowish hue. They are commonly observed on the buttocks, thighs, elbows, and back of the knees, although they can develop anywhere on the body. These nodules tend to be sensitive and itchy, regardless of their location. Eruptive xanthomatosis is the medical term for this condition, and with proper diabetes management, these bumps typically vanish swiftly. Number 9. Granuloma annulare, characterized by raised nodules that can be red or match the skin color, is a skin condition linked to diabetes. Though not all with the condition have diabetes, research shows a higher prevalence among diabetics. Incidence rates for non-diabetic individuals are around 1%, while diabetics have a 3% chance of developing this disorder. If you experience intermittent granuloma annulare, it's recommended to undergo diabetes evaluation. This condition manifests as raised bumps with patches varying in color from skin color to shades of red, pink, or even bluish and purple. Consult a doctor if you notice persistent and widespread pimple-like formations. Number 10. Persistent itching and dryness. One of the most prevalent problems experienced by individuals with diabetes is the presence of dry, itchy skin. This condition, characterized by an extreme lack of moisture, affects numerous people. While elevated blood sugar levels can contribute to this discomfort, other factors such as skin infections or inadequate blood circulation can also be responsible. Number 11. Yellowish scaly patches around your eyes, known as xanthelasma, can emerge. These patches manifest when the concentration of body fat cells in your bloodstream exceeds normal levels. Furthermore, they serve as an indication that your diabetes is not effectively controlled. Therefore, it is crucial to remain vigilant, gentlemen. Number 12. Skin tags are a common occurrence experienced by many individuals. These small growths can be found protruding from the skin, resembling tiny hanging structures. Although generally benign, the presence of numerous skin tags may be indicative of excessive insulin levels in the bloodstream or an existing condition such as type 2 diabetes. These growths tend to manifest in specific areas of the body, namely the eyes, neck, armpits, and groin. As promised earlier, I will now share some helpful tips on how to effectively manage and care for blisters. To ensure the health and well-being of your skin, it is crucial to take appropriate measures when dealing with blisters. Let's discuss the subject at hand. Addressing specific ailments. Firstly, it is advisable not to attempt to rupture or burst a blister, as the skin covering the blister serves as protection against infection. Instead, delicately cleanse the affected area with lukewarm water and mild soap. Applying an antibacterial ointment to the blister without popping it is recommended. Subsequently, cover the blister with a gauze pad, ensuring it is not wrapped too tightly. Alternatively, a cotton bandage can be utilized. To secure the dressing, it is best to use hypoallergenic or paper tape. Remember to change the bandage regularly and refrain from wearing the same pair of shoes until the blister has healed, particularly if the blister is on your foot and caused by ill-fitting footwear. Now, let's turn our attention to managing small cuts and rashes. Once again, it is important to gently cleanse the affected area with warm water and mild soap. Avoid applying alcohol, as it is not effective and can cause further discomfort. Instead, administer an antibiotic ointment to the affected area and cover it with a gauze pad or cotton bandage. Secure the dressing with hypoallergenic paper tape. Ensure to change the bandage daily. It is also crucial to regularly inspect the area to monitor any signs of worsening discomfort or infection. In conclusion, we have covered the recommended care for blisters, small cuts, and rashes. We hope you found this information helpful. If you have encountered any of these conditions, please share your experience and the measures you took in the comments section. Thank you for watching. Remember to like, share, and subscribe to our channel. Your support is greatly appreciated.